Hello, 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 everyone. Happy Self-Care Saturday. We are so excited to be back live. I'm really excited to welcome our special guest this Self-Care Saturday, Dr. Lindsay Banks. And today's topic is chiropractic medicine and the 8 degrees of wellness. And I'm really, really excited to have her on. She is an expert in the field, and a lot of people may think that, chiropractic medicine is like if you get into a car accident or you have back pain, but it's so much more. And I'm so excited for her to share with everyone today. So we'll actually start off with introductions because many of you may be catching the replay. So if you haven't met me before, my name is Mia Bradford, and I'm the proud founder of Beyond the Busyness. And my goal is to redefine self-care to encompass physical, emotional, and financial well-being. And I really, truly want women to be able to practice guilt-free self-care and really begin to put themselves first through and move from busy to balanced. So, Dr. Lindsay, thank you so much for being on with us today. Can you tell us a little bit about yourself, where you're from, and how you got into chiropractic medicine?
Yes, so my name is Dr. Lindsay Banks, and I am owner of Healthy Motives 365. And my mission is to help clients find health in every day by assisting them in eliminating the bad habits that can lead to chronic disease. So I am currently residing in Houston, Texas, but I am from the Midwest, right outside of St. Louis. I'm from a smaller town, Alton, Illinois. And I got into chiropractic. I've always, been somebody that was really into health and wellness and fitness. And I always wanted to do something that was more preventative and that's why I got into chiropractic care. I know when I was younger, my dad actually used to go see a chiropractor, and he would take me, he took me a few times and I got interested in it. But I really got interested in it when I got done with undergrad and I had graduated, and I was working at a home health agency. And I was working with this older lady, and it was something that, like she said, that pretty much kind of changed my mindset when it came to my health and wellness. And she said that, make sure that you take care of yourself when you're younger, because when you get older, you're going to pay for it. And that's why you're here assisting me now. And so that kind of really spoke to me. And so even though I was already, into health and wellness, that really kind of geared it up. And I got into more preventative healthcare, which eventually led me to chiropractic school.
Excellent. So basically, you were really attracted to the preventative part of chiropractic. And yes. I really like that you said that. So everyone who's watching, think about prevention. So many people, again, like I said at the beginning of the broadcast, think that, chiropractic is if you have back issues, if you've been in a bad car accident. But, we know that that's not exactly the case, and that chiropractic medicine is so much more. And as a person that has been going to the chiropractor now for maybe, almost a year now, like I've definitely noticed some major improvements in my health. So can you share exactly what chiropractic medicine is for people who are like, well, what is it and why should we do it?
Absolutely, I'd love to. So chiropractic is a healthcare profession that focuses on disorders that affect the musculoskeletal system. So that's just a fancy word for the muscles and the bones of the body. And we also assess the nervous system. So chiropractors, we recognize that the body, it has a very unique ability to heal itself. And by using spinal manipulations, we also are known as adjustments, they help to restore function, and they support the nervous system to allow the body to perform optimally. So as a chiropractor, I don't heal your body. My job is to remove any interference that may be hindering your body's ability to heal itself. So your body has, I don't know if you've ever heard of it, it has what we call innate intelligence. Mm-hmm. So it's very smart, which is why when things become imbalanced in the body, it starts to compensate. But the issue arises when the accommodating factors, they go on way too long, and then that starts to lead to, disease in the body. So, for most people, like I said, they're not really familiar with chiropractors and how educated we are and all those things. But chiropractors are licensed professionals that treat their patients essentially without the use of drugs or surgery. And along with, the spinal adjustments, the care can include soft tissue therapy, so addressing the muscles, lifestyle recommendations, which is what I primarily focus on, because research is showing that, lifestyle and environment has a very huge effect on our health, even more so than our genes sometimes, because though our lifestyle and our environment has the ability to turn on and off our genes. And so by addressing the whole body rather than just, one area or specifically a symptom, then it helps to increase the overall health and well-being of the patient. And there's one example that I like to use to kind of make it simpler for people to understand. For example, if a patient presents with like chronic headaches or migraines, and you take them to take like an over-the-counter medication, or even if they take, something even stronger, if they go get a prescription, then, just taking that medication is really just addressing the symptom of the issue. So the pain is going to come because you think about it, you're going to have to take that medication a couple of times a day or every day. As a chiropractor, I'll assess the patient to find out what is the root cause of the pain, so that could be a misalignment of the cervical spine in the neck. It could be muscle tension because you're stressed out all the time and those muscles are pulling on the bones of the neck and the skull. It could be something in your diet. So processed foods, alcohol, food sensitivities. It could be because you're dehydrated, or you have, poor posture, or you're skipping meals and you have low blood sugar. So as you can see, all of those things, if I'm just taking like a medication, is not necessarily addressing any of those things that may be actually causing my headache. And so those headaches are going to continue to come. So pretty much to sum it up, chiropractic is all about holistic health and prevention, which is why, like I said, I was attracted to it in the first place.
That's a great explanation. Thank you so much. So I'm over here taking notes because I'm a nerd.
I am too, girl. Nerds unite.
Yes, nerds unite. Hello and welcome to everyone who has just joined us. So what I heard was that you treat, first of all, preventative. I heard holistic. I also heard that you treat symptoms. You actually don't treat symptoms. You get to the root by evaluating the whole body, and that you help to treat these symptoms without the use of drugs or surgery.
Correct.
So to me, that sounds amazing because, personally, as someone who hasn't used pharmaceuticals in over 3 years, I learned that, pharmaceuticals, a lot of times it damages your liver and things like that. So it sounds like this is something that anyone can really tap into to kind of treat different symptoms or, different ailments, I should say.
Absolutely.
Excellent. And you did mention earlier about the spine. So, and like how you do a spinal adjustment. So can you talk about how spinal wellness impacts your overall health?
Yes. So as I stated before, chiropractors, we also focus on eliminating interference with the nervous system. So your nervous system is your brain, your spinal cord, and all the nerves that come off of the spinal cord. And so the skull and the vertebrae, and I have like a spine right here. Let's see if I can get this. Can you see it?
Oh, you're fancy.
Bro, I got it. I'm ready. So you have your vertebrae, and the vertebrae are these, bones that are in your spine. Okay. So when you hear that, they're just essentially the bones of the spine. And the skull and the spine are designed to help protect the brain and the spinal cord. So throughout life, when we have, physical stress on the body from maybe bad posture, falls, whatever it may be happening throughout life, these bones can actually get out of place. And they result in pressure of the nerves that come out of the spine. If you can see, I'll kind of turn it to the side here. I don't know if you can see, but right here, these little yellow things, those are nerves, okay? So you have nerves that come out of the side of the spine, and they go to every organ, structure, tissue that's in the body. And your nervous system is actually the very first system in the body to form. So it is the master control system that tells all other systems what to do. So if it has any interference, then ultimately it's going to have an effect on your overall health. Because you think about, like, if somebody gets a serious brain injury, or they get a serious, injury to their spinal cord, whatever that area is going to, it may not work again, or you may have serious complications. And that's why it's very important to, adjust those bones of the spine to make sure that they're not creating any interference on those nerves and causing other ailments in the body. To give another kind of like a simpler example, I used to talk about like a phone, but we all have cell phones now. So I'll use an example of this like Bluetooth speaker here. So you think about it, like if I was to try to turn this on and play some music and it didn't work, then, I might try to like, okay, let me turn this on, let me turn it off. Okay, this is not working. Still no music coming out. And so if I just focus on the speaker and I never look to see, okay, well, maybe it's my Wi-Fi router, or maybe my internet provider is like having issues right now. But if I'm just looking at the speaker and I'm focusing on the fact that there's no music, then I may not ever fix the problem. And so, as chiropractors, we're not just going to look at that symptom, like that music. We're not just going to look at that. We're going to do a little bit more investigating to see, okay, what's causing this particular ailment that my patient may be having. And so spinal wellness is important, but ultimately my goal as a chiropractor is to find any type of interference that may be having in the body and remove it. So again, like I said, interference could be a bone out of place. It could be a nutritional deficiency, meaning that you're not eating right and you're not getting the vitamins and minerals to make your body function properly. It could be a hormonal imbalance. So, our hormones, especially as women, they're affected by our environment, by stress, the things that we're eating. And then speaking of stress, you have physical stress on the body, you have mental stress on the mind, and you have chemical stress, through the things that we eat. So all of these things, can be creating some interference, along with looking at the spine, which is something that I'm actually working on right now. I'm actually getting my certification in functional medicine. And so, chiropractors in the majority of states, we're able to do labs. We can, look at your hormones. We can, look at your lipid profile. We can look at all these things and to help to guide you to say, okay, well, you're deficient in this particular nutrient, or, your hormones, your estrogen levels are higher or whatever. And that's something that I wanted to add to, my tools that I use to treat patients. So now I have a combination of, okay, yes, I'm looking at the spine, I'm looking at your physical health, but now I'm also going to be looking at your internal environment to see, if you're having a hormonal imbalance, if I'm adjusting you, but I'm not looking at that imbalance and telling you things that you can do in your lifestyle, then you may still be having some of the same issues. So again, once the root cause is found, function is restored, and the body will take its natural course in healing. So one thing that I like to say is a disclaimer. Now, of course, I'm all about prevention and, not taking medications or, having major surgery. But of course, depending on the situation, there may be some instances where you may have to take a medication, or you may, have to get some type of surgery. But with that being said, chiropractic is a great choice to use in conjunction with other allopathic, or that's a fancy word for mainstream types of medicine or care. But for most chronic conditions, the things that we suffer from on a daily basis, if you simply change your daily habits, it can significantly reduce your risk for, developing all of these chronic conditions, which is why I focus on prevention and lifestyle. So my goal is to address the patient's initial concerns, which usually is some type of pain point. Again, a lot of people come to chiropractors initially because they're having some type of pain. But once we get past that pain point, the goal is to transition that person into wellness care. And at that point, the goal is to focus on what habits, your patient needs to do or to adopt to prevent them from going back to where they started from having that pain. So I think of wellness care as kind of like car maintenance. Do you get maintenance on your car because there's something wrong? No, you get it because you want to prevent something major from going wrong. So wellness care is the same concept. It's all about prevention.
I love that. I love that. So some of my key takeaways, I really liked how you talked about that, like you said, you can have a headache. Like actually Ronnie, she's on here now. She says she has a headache, right? And you might think, okay, let me go and, take an aspirin or whatever have you. But what a chiropractor would do, because I'm a person that also suffer from headaches, is that you're going to see, okay, do I have a nutrition deficiency? Is it my hormones? Because I notice when it's the first day of my cycle, I always have a headache on the very first day. Like I've noticed that pattern. And so what I like to do is I actually, fortunately my chiropractor is like right down the road. I can go and get an adjustment and that will help my headache to go away. And so I really appreciate that. I'm in the wellness stage of my care right now. But I really appreciate that you all look at the internal environment and you don't just treat, oh, you have a headache. Okay, here's a Band-Aid and, it'll be okay for now. But you're looking to make sure that the situation doesn't keep returning.
Exactly.
Yes. So that's amazing. So
which
like,
is costing you more in the long run. You know what I mean? If you don't actually treat the actual cause, then how long are you going to have to pay for this, prescription medication, or how long are you going to have to pay for this over-the-counter medication, because you're not treating what the actual cause is. And financial health is just as important as everything else, because your financial health can affect other areas, of your body. But I'm talking to the queen about finances, so let me, that.
No, you're right. You're absolutely. I'm so glad that you said that, because, like I said, emotional, physical, and financial wellness is super important to me, right? I like to look at the whole person, and which is why I gravitated toward chiropractic medicine, because it looks at the whole person. And if, like I had a situation, I'm prone for whatever reason to chronic inflammation in different parts of my body, right? But going to a chiropractor, at first I was on all these anti-inflammatories, but by changing my diet and going to a chiropractor, I'm no longer in a constant state of inflammation. So one, that saved me a ton of money on buying of anti-inflammatory prescriptions, because, I don't do pharmaceuticals anymore. And two, it saved me a ton of money on having to go to the physical therapist, because my insurance really doesn't cover anything. And so this has been really transformative for my own personal life. And so what are some typical illnesses and ailments that people come to a chiropractor for? And ladies, if you have any questions, please put them in the chat, because I'm monitoring the chat as well.
Okay, so basically, what conditions do chiropractors treat? Okay, so most patients are going to, like I said, are going to see chiropractors because they're having some type of back pain. But chiropractic is not just about back pain. I know when I first started, a lot of people, just thought about personal injury and car accidents and things of that nature. But doctors of chiropractic can treat a range of different conditions. And that includes, so carpal tunnel, headaches, migraines. If you have issues with your extremities, so your shoulders, your knees, hip pain, whiplash, sciatica. But again, like I said, along with all of those physical components, they're also going to address things, like stress and nutrition and other things that can influence your overall health in an attempt to manage and prevent chronic conditions. And so some people, like I said earlier, people don't realize, how much education that we have to go through as chiropractors. And chiropractors are highly skilled, trained professionals, and we have the knowledge, skills, and abilities to also recognize that there are conditions which may require more invasive treatment and protocol. So once a patient is assessed, if a referral to another healthcare practitioner is warranted, then it's, the responsibility of the doctor to refer them to the appropriate medical professional. And that's why it's important for medical professionals to communicate, because the ultimate goal should be getting your patient better. And that's the definition of patient-centered care. I want to work with your other healthcare providers to make sure, that everything that you're getting that's going on is getting treated. Like, for example, if as a chiropractor, if I'm treating my patient and I've been treating them for a while, and I notice like a mole on their back and it's getting, bigger, and the edges are changing, then I might say, okay, well, have you, went to a dermatologist to check this out? I am not a specialist in skin, you know what I mean? So I would know, okay, I need to refer this patient out. So those are the types of things, like I said, we treat all different things, but we also know when and if, you need to refer a patient out to somebody else.
That's awesome. And can you talk about also, what can someone expect on their first visit to a chiropractor?
So yes, your first visit to a chiropractor is similar to a visit with any other, practitioner. So a typical first visit may include an interview with the doctor so they can get to know your detailed health history. And a lot of times we have patients fill those forms out ahead of time so I can actually look at it and study it and get to know your health history. You may get a physical exam, including orthopedic and neurological testing, depending on, what symptoms or what issues that you're having or what your chief complaint is. You may get lab testing, x-rays if warranted. So if you were in a car accident, if you had some type of trauma and you fell, you may need to get an x-ray because you don't want to adjust a bone if it has a fracture in it, so that would be a definite contraindication. So it just kind of depends. X-rays aren't always warranted, but like I said, if there's some type of trauma, you may need x-rays. And then from there, there's a follow-up visit that's scheduled. And at that visit, your chiropractor is going to deliver the report of findings, essentially what they got from your exam. And then they'll discuss their treatment protocol. So once they come up with a treatment protocol, treatment will commence and progress And they'll basically assess to make sure that the treatment that they're giving you is effective. And so one thing that people I've heard is that like once you start going to a chiropractor, you always got to go back and you got to keep going and things of that nature. But you have to think about it. Since care is hands-on, it requires the patient to be present in the office, which is why you may have regular weekly visits to the doctor. So you think about the same, compare this to, okay, I went to my medical doctor and I was having really bad migraines and they gave me a prescription. Okay, well, think about every time you take that medicine, it's kind of like, okay, I'm seeing my medical doctor, but as a chiropractor, I have to adjust you and treat your body. So that's why you have to come physically see me. I can't adjust you through a pill, or I can't adjust you through, a telehealth consult or whatever. You have to physically come see me. So that's one thing that patients have to understand. It's more of a natural, healthcare solution. So natural healing, anything natural is going to take time. And although some patients, experience immediate relief after treatment, others may need several visits to help, aid the body in restoring function. But one thing is also important. It also has to do with the patient's compliance as well. If you come see me and, I'm adjusting you in the office and then I'm saying, okay, at home, you need to make sure that you're staying hydrated, go to sleep at a reasonable hour and do these particular stretches and exercises, but you're not doing them, then it may take you a little longer to get well because, again, as your healthcare provider, my job is to, guide you and help push you and motivate you and treat you. But ultimately, you also have to be responsible for your part. So it's a teamwork. You have to do what you got to do to get better.
Excellent. I was going to say that, what I realized from what you just said is that our body internally has everything it needs to heal itself. I mean, if you think about it, when we have some type of infection, we get a fever, and that's our body fighting off that infection. And so when you do the spinal manipulation, that is, getting everything to communicate how it's supposed to be communicating, making sure the nerves are communicating in the right spots. Exactly. And that's just amazing that, the touches that you all do is able to get everything back functioning again. And also, as a patient of chiropractic, I noticed that when I don't have my adjustments, my body is not a happy camper. So, like, it's true. It's like I can definitely tell the difference. Because like I said, I suffer with headaches from time to time and also a pinched nerve. And for whatever reason, my hips, because they're so tight, like any movements, lateral, Ronnie, what is it again? When you move and whatever plane it is, I forget now. But anyway, it's some plane.
Your transverse plane.
No, it's whatever one is side to side. So is that a medial or transverse? See, y'all.
Transverse.
Transverse. Thank you. See, we learned this last 2 weeks ago.
And then, bend to your side, that's lateral, medial. I mean, you got all types of things, girl. Yes. Let's not get into anatomy and physiology because I'll get started on that too.
This is what we had to learn in yoga teacher training. And as you can see, I need to refresh already. So I noticed that any movements from side to side, they hurt. And then when I get my adjustment, amazing, transverse. Thank you, boo. Appreciate you. You're looking out, sis. So moving right along. I did pass the test though, y'all. So don't worry about that.
Congratulations.
Thank you. See, Ronnie remembers. That's my homegirl. That's my yogi sister right there. She came through in the clutch. So, ladies, don't forget, if you have questions for Dr. Lindsay, please put them in the chat. So my next question that I have for you is, how does chiropractic connect with the 8 degrees of wellness? And, if you please explain the 8 degrees of wellness for those who are not familiar with it.
Absolutely. So like I said earlier, I may not have said it, but chiropractic is a lifestyle. So it takes a holistic approach to healthcare. So everything is interrelated. So just like the 8 degrees of wellness. So the 8 degrees of wellness, it's physical, intellectual, emotional, social, spiritual, occupational, financial, and environmental. So those are the 8 degrees of wellness. And basically, anything that happens in one area can affect the other. So for example, if you are having I'll just say, if you're having issues at your job and it's stressing you out, that can affect your emotional health or your mental health. Your mental health can then affect your physical health. Now, if your physical health is out of whack, now you may not be able to go to work anymore, and now that's affecting your financial health. So you see, everything is related, everything. And so when we don't have balance in all areas, then it can cause issues. So say, for example, as a chiropractor, if I'm only looking at the physical component of health and I'm not looking at the other areas, I may not be addressing the root cause of your issues. Like I said, if I'm, adjusting your spine, but you are stressed out at work, or you're stressed out because you're not, exhibiting good self-care, and your muscles are always just bunched up, then I can treat those muscles. I can adjust your spine all I want to. But if I'm not saying you need to take time for yourself, self-care, you need to figure out, if you need to change careers or what have you, then you're still going to be having those physical issues. And so life stressors in these areas have a huge effect on your physical health and overall well-being. So again, it's all about holistic health.
I love that. Hang on. I'm actually pulling up your article right now on the 8 degrees of wellness, because Nadine just asked for that, which is a fantastic question. Hey, Vivian, thanks for joining.
Oh yeah, I could have. Yeah, I got a blog about that, and it talks about it and how you can manage each area as well.
So please check out this blog that I just put in the chat, everyone. It's really good. Dr. Lindsay wrote, like she said, it has all the 8 degrees, and then she talks about how to implement those things. And the reason why I'm so drawn to chiropractic medicine is because it is very holistic. My doctor, she talks to me about, okay, well, what is going on in your life? Because she'll say, okay, last week you came in and you weren't so tight. And I was like, yeah, because I did yoga for 3 hours in a day. And then this week, I did a lot more aerial. And she was like, well, when I do aerial, because of the way that I'm pulling up, it's tightening up my back, which is, kind of taking me backwards in my practice. And so, backwards and loosening up my back, which is where I carry a lot of tension. So she's like very aware of the changes in my body, more so than I am. And I'm like, oh, okay, Dr. Candace, no problem. Like, I'm going to do a little bit more ground yoga. She was like, I like when you do ground yoga because your body feels so much better. She'll like even do like massages with essential oil and like get the knots out of my back. So your chiropractor will really meet you where you are in terms of what your body needs. And I think that's a major, major bonus. So go ahead.
And I was going to say that also brings up another topic, just thinking about like, okay, so how does chiropractic work and what types of things that we use? But one thing I wanted to say before I get into that is you brought up a very good point. When you come in, your doctor takes time to ask you how you're doing. She spends times with you to figure out, and she remembers, you're more than just a patient. You're a person. She knows your name. She spends more than 3 minutes with you. So if your doctor is not taking the time to talk to you about like how your lifestyle choices may be affecting your health, that's a very big component in your overall health care. And that makes a big difference. And it makes you, want to continue to come to see that person because you have that good relationship and you trust them because, okay, this person, they really care about me. I'm just not a number. I'm just not another patient. And so when you think about that, that is a very important component, to have with your healthcare. But I wanted to kind of go back to you talked about adjustments and you talked about soft tissue massage and therapy. But I kind of wanted to go back to talk about like there are different types of chiropractors. And so, we use a variety of different techniques. Most people see, online, they see where the chiropractors adjust and there's like the popping sound, but we have way more techniques than that because, everybody doesn't necessarily get that type of treatment. So there's chiropractors that specialize in pediatrics. They get a special certification to work on infants and babies, infants and babies, they're the same thing, children. And then pregnancy, there's a technique called Webster, where chiropractors are certified specifically to treat pregnant patients. There's chiropractors that focus on sports rehab. So chiropractic is safe and natural. I've been adjusting my kids since they were little. When I went to chiropractic school, my oldest, at the time he was 9 months old. and I would adjust him. And then my youngest baby, I was 7 months pregnant when I graduated from chiropractic school, and I was adjusting him, after he was born. So regular chiropractic care helps to relieve stress on the body, and it leads to overall well-being. And so, like I said, we use a lot of different methods to help, with joint function, increase flexibility, and relieve pain and stiffness. Like you said, you feel your hips getting tighter. And as you get older, it's very important to be able to maintain your flexibility and your range of motion, because you want to maintain your sense of independence. If you can't get around, then it's going to be difficult. You may have to rely on a walker or something like that. And so they use adjustments, soft tissue therapy, ultrasound therapy, that deep heat helps to increase blood flow. So there's all these different things or different techniques that chiropractors use. So it's more than just the adjustment or what have you. I see a question. Mm-hmm. Says, Dr. Banks, do you recommend everyone to get an adjustment? Absolutely. I recommend, if you've never gone to see a chiropractor, I recommend to go. And the thing about it is, most people, like I said, they really don't understand what chiropractors do. Like I said, most people say, well, I've never had back pain, I don't need to go. But as you've listened throughout this entire, live so far, we're more than back pain. If you want a doctor that's going to really focus on helping you with prevention and getting to the root cause to things, and not just, taking medications. Again, not saying that I'm against medications or anything like that, but, people have preferences. Like you said, Mia, you prefer, more of a natural, holistic type of healthcare. And I do for myself. And a lot of people are turning to that. Because think about the commercials that you see, you have, a prescription. Okay, it's treating this. But now I got 20 other things going on. Oh, I fixed this. And actually, did you fix it, or did you just block the biological functions that are happening? And now a whole bunch of other things are happening. Because you think about it, the reason all those symptoms start to happen when you take medications is because everything is connected. And so I definitely recommend that you go, get assessed to see what's going on. And, even if you're not having any pain, getting an adjustment is going to help to, like I said, make sure that your nervous system is functioning better, and all the things that your nervous system control as a result will start to function better. You may sleep better at night. You may notice better digestion. You may notice I can breathe better. There's so many different things. And so I definitely recommend everybody go to a chiropractor.
Me too. I mean, clearly I'm not a chiropractor, but I do recommend it.
But it's funny because, and the thing about it is, as chiropractors, when we're in school, it's we're in this bubble and we talk about chiropractic and we get so enthusiastic about it and we just all just love it. But honestly, we don't do a good job of, when we get out of school and we start our practices, it's getting better now, but really educating our patients about the benefits of chiropractic and everything that they can do. And that's one thing that I really want to do. Especially with my community, especially dealing with women, especially Black women, I want to make sure that this is golden. This is something that we all need to have in our life, because, a lot of times we take on everything, we take on all the stress, and we put ourselves last. And now we have all these issues. So chiropractic, like I said, being a type of prevention and natural, holistic way of getting healthcare, we're going to be able to help you, really function and find, we don't want to say balance, but harmony in your life, to make sure everything is working properly, because again, everything is related.
I cannot agree more. So can tell us, Dr. Lindsay, what type of services do you offer, and how can we find you, in case, because I know all my ladies listening, they're going to need an adjustment and they're going to need your services.
Okay, so there's a few services that I offer at this time. So I offer lifestyle coaching, and I do that because I'm in the northeast. I'm in the Humble, Atascocita area. So I do lifestyle coaching, and I do that, via telehealth. And so that, physical activity, nutrition, effectively managing stress, proper self-care. So basically it's all about support, guidance, and holding you accountable to make sure, and I really focus on really high achieving women that are very health conscious, because I know a lot of women like Mia, yourself, you building a business, and then, you're working and you got all these things going on. Well, I always say, how can you build a brand and you're not, taking care of your health? Because eventually the goal is to be successful. But if your body's breaking down, when you hit that, you know, where you want to be, you may not be able to enjoy it. So lifestyle coaching is something that I offer. I also have an online course that's called Transition to a Healthier Lifestyle. And so this is for, you know, if you're somebody that likes online courses, it's self-paced, and it's basically, it has 5 phases. And it's something that, like, if you're ready to really, truly transition to a healthier lifestyle, it is a good course to take, because it's going to help create that foundation to start to transition you to a healthier lifestyle. So now you're a healthier overall person, and you're not like about the quick fixes. This is like, I'm ready to change. And I am now in the northeast area of Houston, so I'm starting to offer mobile chiropractic care. And then at the beginning of next year, I will actually be offering care through a physical location. So I was supposed to open up my location, what was it, in June, but again, with everything going on, I decided to kind of put that and move it back to early next year. And then I also am, at the end of August, I'm starting to do online fitness boot camps, and I'll be doing those via Zoom. So for those ladies who, you know, your gym's closed or you don't want to go to the gym and you want to work out, I do a lot of things that you can do at home as far as exercise, where you don't need a lot of equipment and you're able to still stay in shape. And so you can check out my website. I think Mia just put it up at www.healthymotives365.com. And on social media, I'm on Instagram, Facebook, and then also YouTube has a lot of videos, exercise videos, things you can do at home. And so those are the areas where you can find me on social media or online.
And I don't know if y'all noticed in the group, Dr. Lindsay has been consistently posting some of her awesome workouts every Wednesday and Friday. She's always posting in our group. So she's one of our group administrators, making sure that we stay healthy physically. Because again, like she mentioned earlier, our emotional and physical is all tied together. So it's really important that we take care of our physical health, because it will impact our mood. It will impact, you know, just anything and any type of wellness that we have. Because I noticed, like, I started working out every single day now. Yoga, okay, like I do yoga every day, and
but that's working out, girl. Because look,
it's hard. It is hard.
Like, but think about it, is you talk about strength. Like, you know, I lift weights, I do toning exercises, but give me in some yoga, I'm like, oh, you know. So it's a different type of strength, girl. That's working out, because I need to do me more yoga.
Yes, come to my free classes every Wednesday and Friday.
Yes. I will, right? My life is just like, it's a lot going on, trying to balance.
I understand. So please check out Dr. Lindsay's YouTube. Check out her Facebook page. She's on Instagram. I follow her. I admire all of her amazing things that she's doing. I met her actually at a wellness walk. That's how we connected. And I just really,
shout out to Queen Life. That's where we met.
Yep, Queen Life. Awesome sauce. Thank you, Queen Candace. And we just connected around just our love for health, our love for helping Black women to be healthy. And, you know, that's why I was like, okay, we got to do this live, because I know how chiropractic has changed my life. And I really wanted you all to know what it was as well, and how it can impact your life on a preventative level. Like, we don't, just because, like, my dad has diabetes, my great aunts, they all had diabetes, my grandmother. I'm not going to have diabetes. Like, I refuse. Like, I don't care if it's hereditary. That is just not what's going to happen, because I'm going to do as much preventative work as I can.
And honestly, that is the key when you talk about, like, because it's not hereditary. A lot of times, like, diseases that run in families, it's not the diseases, it's the lifestyle habits that run in families. And that's what's causing everybody in your family to get those conditions. So prevention.
Exactly. Hey, Shinga, welcome. So, but before we go, ladies, I have to tell you that Dr. Lindsay is in a wonderful contest, a competition right now for Miss Health and Fitness 2020. And she needs to win. So we need you guys to vote for her. Every day you can place a vote. So can you tell us, Dr. Lindsay, okay, where do we go so we can vote for you? Because she needs to win. She really does a great job of educating the community. And I really want to see her win this $20,000 prize so she can open up her clinic, which is going to positively impact the African-American community.
So with Miss Health and Fitness 2020, again, it's a competition and the grand prize winner wins $20,000. And so my goal with this is, like I said, to create a wellness center where I can, impact my community, offering chiropractic, functional medicine, wellness classes. And then I really want to offer workshops for the community, because the thing about it is a lot of times, like, they talk about all these health statistics with Black women. It's not that we don't want to be healthy, it's that we need tools and we need the resources. And so that's something that I want to be able to provide. So again, you can vote every day. You can, on my Facebook profile, Lindsay Banks, I have the link right in there in the description. If you look me up on Instagram at Healthy Motos 365, again, if you click the link tree, it's the first link in there. And you just vote every day through Facebook. Right now, it's down to the top 10 in each group. Then I'll go to top 5. And then after the top 5, you have to be the first in your group to move on to the final. So I would definitely appreciate your support in that, because Mia, we're going to link up and then we're going to have it popping with these workshops and this yoga classes, and we're going to make it happen.
That's right. That's right, y'all. So when Dr. Lindsay opens up her wellness center, I'm going to be teaching over there. And maybe Ronnie, you want to come and teach over there too? You know what I'm saying?
Yes, I'm gonna need instructors, massage therapists, all of it. I'm trying to create, like, literally, a wellness center. It's not just about chiropractic. It's about all different types of preventative healthcare that, so we can get ourselves healthy and stay healthy and help each other and support each other.
Exactly. So please go check out Dr. Lindsay. Like she said, on her personal profile, there's the link. It's also in our group. I believe it's in the announcements in the group. And just show her some support, because, we got to support each other, ladies. And if there's support that you need from this group, you can only vote once a day. So just you go back each day and vote. Unless you want to buy votes, you can buy votes too. But it's one free vote per day. So thank you for that question, my love. So please, if anyone has any last questions before we jump off. Thank you, first of all.
Reach out to me if you need any help. I also offer free 20-minute consultations. So if you just want to schedule one and have a talk and talk about things that are going on to see if it would be a good fit. Because that's another thing, I always, when I do take on new clients, I start off with the 20-minute consultation, because I want to make sure that you're a good fit and that you really want to get healthy, and anything that I can do to service you. Because if we're not a good fit, then of course I may guide you to somebody else. So that's what it's all about. And I just thought about this. I want to end this like with a quote. I don't know if you guys have ever heard this quote, but it's from Thomas Edison. And the quote, it says, "The doctor of the future will give no medicine, but will interest his patient in the care of the human frame, in diet, and in the cause and prevention of disease." And he said that like all the way back in like the early 1900s. And so it's time. The future is now. We're all about prevention.
I love that. That was such a beautiful ending. And I think they have that quote up in the office.
Really? That's awesome.
Yes.
And that's one of the first quotes that we like in chiropractic school. Everybody's gonna learn that like day one. The philosophy of chiropractic. That's what we're talking about.
You guys, this is actually a movement, because everyone is starting to notice, especially with this pandemic going on and people being concerned about their immune systems. Everyone is moving back to the basics, back to essential oils, back to, gardening and growing your own food. So this is a movement, and we have to do this in our community. And if you think about it, not to dampen the mood, but as descendants of slaves, we know agriculture. Like, we understand how to till soil, I think that's how you say it, and how to like grow plants and use things for prevention. So, I really just encourage everyone to find your path, right? Chiropractic, oils, gardening, Ayurveda, acupuncture, whatever it is that is natural, that is going to be preventative for you, and that is going to help you be the best you that you can be all the way around, holistically.
Yes. It's time to start prioritizing ourselves and really taking care of ourselves. And that's the best way to do it. Absolutely. Because it's going to prevent all that other stuff from happening, all the chronic stuff.
Yes. And the last thing I just want to say is ladies, just, keeping your stress level to a minimum, because that's really, and I know that's easier said than done, because it's environmental, it's work, it's family, it's this and it's that. But if you can, finding a way to get to an internal state of peace, no matter what is happening around you, really, really helps your mind and your body to stay healthy. So yeah. So thank y'all for joining us. Have a wonderful rest of your self-care Saturday and a fabulous self-care Sunday. And thank you so much, Dr. Lindsay. I'm looking forward to getting that $20,000 prize because this is a community and we are all cheering you on.
Yes, definitely. And any way that I can support any of you, let me know as well.
And she means that, y'all.
I do mean that. That's not just, you know.
No, she's very.
I'm not about talking.
She not. So thank y'all for joining us. Thank you, Ronnie. Thank you, Nadine. Thank you, Shinga, for joining us and staying on to the very end. We appreciate you, and I hope this was beneficial to everyone. Have a great rest of your day. Bye.
Bye.